Hello everyone, my name is Ronki George, and the case study I chose for this presentation is infant mortality in Louisiana, and I played the role as a researcher. In this presentation, I'll be explaining why I chose research. And my reason for choosing research is to understand, in order for us to be able to prevent infant mortality, in order for us to be able to educate people, we need to understand what infant mortality is. And since in 2015, Louisiana was rated, the state of Louisiana was rated number 2 worst infant mortality rate in the United States. And I'll be explaining more in details as we go along in the slides on infant mortality rates in Louisiana. So on this slide, I explained, I broke things down into ethnicity. In Louisiana, infant mortality rate is higher. It's about 13% in African Americans, and I think about 11 point something percent in Native Americans. I broke everything down, and it also infant mortality, like stated above, infant mortality in Louisiana was actually rated number 2 worst states that had the high infant mortality rates. And as public health representatives, I looked into what the cause of why Louisiana preterm rate is about 12%, according to the match of media prenatal care and all that. I looked into it and realized that infant mortality rates in Louisiana is high because about 80% of residents in Louisiana live below the poverty rates in Louisiana. Socioeconomic status is pretty low. The lifestyle over there can be a factor to it. The environment can be a factor. Not having good access to health care can also be a huge factor into infant mortality rate. I know in Massachusetts a law was passed that no smoking in public places. That's something I don't know. The environment matters a lot. Having a poor environment can lead to infant mortality rates, and it's really high in African Americans and low socioeconomical status. All right, issues on this slide. The state population in Louisiana live below the poverty rate. Oh yeah, I mentioned that earlier. Live below the poverty rate. Live below the poverty rate in about 80%. About 80% live below the poverty rate. Age, the women become less fertile as they get older. That's also a factor. That's an issue. Um, um, yeah, the older they get, the higher the risks of preterm birth. Environment, as stated earlier, actually, the environment you live in, how clean is it, how well educated are you, is the environment, how easy access do you have to the community center, the health center, to the hospitals, to even healthy food choices. What are the healthy food choices do you have? Some places, like in my community, we don't even have whole food. We don't even have market basket. What we have are not even healthy options. So you have to go outside of the city, outside of my community, to get healthier food choices. Those are also factors and issues that can relate to and can increase the mortality rate. And also that was a factor in Louisiana. The lifestyle. Do you smoke? Do you drink alcohol? How do you maintain your body system? Do you go, how healthy are you? Do you visit your primary care doctor yearly, or maybe in 5 years, or only when you have issues? All that. Family history, your life history also matters a lot. Everyone have a history, health history, different people and different stuff. How well do you maintain and take care of yourself? Those are factors, those are issues that could lead to infant mortality rates in the in Louisiana. Also, intervention, creating a survey, handing out surveys for people, so you can understand what is going on, like their point of view. How often asking them questions on, creating a baseline measures of mortality and child health. How well do they get immunization? Do they even give the kids? Are the kids being immunized? How often does the kid see their primary care doctors? Where did they live? What are the healthy food options? What did they eat? you know Infant mortality rate is it's high in infants to about 5 years of age. That's a very, very important stage in one's life. Are they being immunized? Having did they see their primary care doctor? Educating them. Are they aware of the environment? Are they educated? Are they creating awareness, creating a health center? Health work where people can come and get flyers, or come and get books, or even support system, encouragement. Having access to just healthy wipes. Supplies that they would need free of charge, since over 80% of Louisiana's residents live under the poverty rate. Do they even have a community center, a support group for mothers, breastfeeding, quality prenatal care, you know family planning? It's also important. People need to know what even family planning is. Also, educating them in just lifestyle choices that they can make to prevent infant mortality rate. Family history, improving birth weights. Better infant and health and child health also plays a role. So is an intervention. Evaluation, observing the environment. How clean is it? Observing the people around. How often are they sanitized? Is the environment being sanitized or cleaned up? Retrieve all surveys that was given to the residents in the community, to women pregnant, just everyone, not even mothers and pregnant women and all, everyone, and do them and calculate how aware they are, what could lead to it, what is the cause of it, and then you can find a prevention measure. Then you can prevent this, because infant mortality rate it's now an epidemic in the United States, and as public health representatives, it is best for us to to assist in the community. Create awareness, reach out to the health centers. Do you have a health center? Do you have even people do fundraising, and or do you have a health educative access? Are people easily accessible to the hospitals, or even to a health center? Just create a this health explore educative ways where people can just come and talk to you, and you can educate them on the infant mortality rates. communication, those are barriers. How if the communication is also a barrier, it's a challenge. you know Different individuals and responses, how different cultural backgrounds in America. Here we're all the different cultural backgrounds. Everybody have different ways of doing things. Are we giving them the awareness? Are we giving them the attention? Are we giving them the education that they need, to prevent all this infant mortality, to protect themselves? Actually, even that, to protect themselves. Budget in Louisiana is not, you know money. It's a high priority. It's a high priority over there. So creating a free health system, a free health care program, or an educative program will be very helpful. Very, very helpful, and could also prevent infant mortality rate. Could also prevent questionnaires. Design a questionnaire form, the way people can ask questions or even write comments or suggestions down. And that way you can promote and prevent, make things better in the community. Lay out a survey, and economical model. My economical model was, staff communication system. The staffs, are you communicating? Are you following up with your patients? Capacity development for public health actions, prevent and referral to improving outcomes. You can that is also very necessary. Identifying and encouraging key internal and external plan, to implement good actions. Develop a prevention referral plan. Exactly. Develop that community bonding where people can reach out. Develop that. Also, another thing was management support system. Work group system where people can come and educate them, where people can come and provide help for them, assistance, apply data, reduce preterm birth outcomes, also increase healthy day among the employees. Just not just sitting down in one spot for 8 hours. Create rooms, or create a physical place, where people can have healthy food options. They can go and exercise. They can go and read. Also, measure level of mortality and health conditions, history, environmental interventions. Those are all things that are very helpful and could help in preventing infant mortality rates in Louisiana. These are my resources I use for this presentation, and I hope you guys got something out of this. I looking forward to everyone's comments and stuff, and I also encourage everyone as public health representatives to reach out to the community, to reach out to people, and to give back, to educate. Just having a conversation with people goes a long way. Educating them in a nice and friendly way. I look forward to your comments. I wish you guys all the best in your career goals.